Sleep last night. If your partner's snoring kept you awake, you should know that St. Louis doctors are working on a solution to that problem. To explain, Dr. Jay Piccarello joins us. He is a Washington University ear, nose, and throat physician with the School of Medicine. So remind us why people snore in the first place.
Well, people snore because it's a partial obstruction of the back of the throat while sleeping. The tongue, the uvula fall into the airway and the air makes a sound, and that's snoring.
It seems like it's worse in men. Is that true?
Yes, it is until the menopause. So before the menopause, men are probably about 5 to 1 more likely to snore. But after the menopause, women catch up, and it's about equal.
Is there an underlying medical issue if people snore?
So, yes. People who snore at much higher risk for high blood pressure, heart disease, heart attack, stroke, and other medical conditions.
Okay, so you are researching snoring right now. What are you looking into?
So we are enrolling patients, adults, in a clinical trial investigating 2 different interventions for snoring. One of them is a jaw device.
And is that what you have with you?
Yes, I do. I have it right here. I can show you. So,
they would wear this plastic teeth guard at night when they're sleeping?
Yep, in the upper and lower. And if you notice, there are little posts here.
They look like vampires.
Yeah, and those posts prevent the lower jaw from falling back and blocking the airway. That's why we snore. The tongue falls back and it blocks the airway. So this post prevents the jaw from falling back when you're sleeping. So this is one intervention. Okay. And the other intervention is a combination: breathe right, nasal dilators, a nasal saline rinse with some steroid in it to reduce swelling, mouth tape to gently bring the lips together, and then the patient is asked to sleep on their side, called lateral positional therapy. So it's a jaw device versus this 4 combination of treatments.
Interesting. So who might make a good candidate for this?
Well, adults who snore, adults who snore and have a spouse or sleeping partner who's very upset about it. And in fact, our study is unique because we're going to be studying primarily the sleeping partner and the impact of the interventions on their ability to sleep.
Because they're the one who experiences the troubles of the snoring. The person sleeping and doing the snoring might not be disturbed by it.
Exactly. I can't tell you the number of times that the patients deny having a problem, and usually the wife is behind him in my office saying he snores.
This might sound a little familiar.
Yeah.
Okay, so what's involved if someone joins the study?
So fill out a few questionnaires, both the person and their sleeping partner, and then they become randomized to either the jaw device or these 4 different types of treatment. And then it's about 8 weeks, and then the trial is over.
Okay.
And if they get randomized to the jaw device arm, they get to keep that. And we think that's a nice incentive also for being in the study.
Sure, sure. Well, we look forward to hearing your results of this, and hopefully there will be some resolution for some families very soon.
Absolutely.
Doctor, thank you so much for joining us
My
today.
Pleasure.